Good morning, Apple lovers. How's everybody doing? Today, I want to talk to you about Lamictal. I was talking to one of my clients a moment ago, and she is thinking about childbirth. She's a bipolar patient. So, she was concerned about having medications that will affect her child. And one issue with patients when they are taking medication, soon as they get pregnant, they are worried about it. So they are worried about side effects of the on the baby. So they don't want to be compliant, they don't want to take their medications, and they want to just avoid taking the medication. What happens with bipolar patient or mental health is you can have suicidal ideations. Your manic episode can become worse, or your depressive episodes can become horrible. Why? Because there are hormonal changes in your body. Pregnancy comes with hormones, right? So your mood swings, everything can get worse. That can increase suicidal ideation. As a result, it's important that you talk to your doctor. One thing I want to talk to you about is mood stabilizers. What category of medications do we use for mood stabilization? Anti-epileptic drugs. These are category of drugs that are used for seizures. One medication that I would recommend if you have bipolar, or that is highly recommended, that I would suggest you discuss with your doctor, is for bipolar depression, is what? Lamictal. What is Lamictal? Lamictal is one of this category I mentioned, anti-epileptic drug, and it is a mood stabilizer. What does it do? The name suggests it, right? It helps with the activation of your central nervous system. These medications also have side effects that affect your central nervous system. Like you have tremors, you have insomnia. You can have insomnia because you are depressed, so you are low energy, sleeping all the time or something. So what Lamictal would do is to help eliminate that or decrease the severity of that. So if you, depending on what time you take it, it can also cause you to have insomnia effect. Like side effects will be insomnia. You can have confusion. You can have, how do I put it? Tremors. You can have anything that has to do with your CNS. You understand? Another effect that it comes with is what? GI symptoms. Like, what do you have? Nausea, vomiting, diarrhea, or upset stomach, right? Another side effects you can see is skin issues. There's a skin issue that's going to cause, that is commonly known as Steven-Johnson syndrome. Most of the time, like the 10% of populations don't have severe symptoms when it's and it's self-resolving. You don't need to seek treatment for it. But the other population of people that have the severe aspect of, or the severe ends of the Steven-Johnson syndrome, you need to call your emergency room right away or call your doctor right away. Stop taking the medication. You can have fever. Steven-Johnson syndrome comes with severe skin rash, sores on your body, your eyes, everywhere, your mouth, everywhere. So it affects your immune function, right? You're gonna have to need treatment for that. So you want to call the hospital or your doctor right away, depending on what time it is. Why I suggest that you discuss Lamictal if you are planning to have a baby or you are pregnant and you are concerned about continuing your psychotropics or your mood stabilizers, is that Lamictal has low risk for teratogenic symptoms. What is teratogenic? A drug that causes your child in your stomach to come out having birth defects like congenital disorders, issues. You don't want that. So you want to really discuss drug choices that have low risk of developing teratogenic symptoms in your child. Lamictal is good for that. It is, we still have researches that need to be done on this, but it is highly recommended by many professionals and by clinic, how do you call it, by research evidence that this is a choice of mood stabilizer that works effectively for pregnant people. It helps with bipolar depression. Okay, another reason to consider Lamictal for your bipolar depression is that it has low risk of weight gain, something we call weight sparing. It is weight sparing. So if you are one thing you need people know, or if you don't know already, is that psychotropics comes with metabolic syndrome, weight gain, depression, weight gain, cholesterol issues, diabetes, and stuff like that. But Lamictal is one of the good ones that puts you at low risk for weight gain. Lamictal also helps with it has low risk for depression, like a CNS depressant. It does not depress your CNS, your central nervous system. It helps to activate it and balance it, neutralize it, so that you are not moving to the manic phase and you are not moving to the depressive state, but you come to just where you need to be, very plateau level. Lamictal is also not a drug that is really, it doesn't fall under the P450 categories, P450 enzyme categories. It is metabolized and secreted in your kidneys, like in your renal system. So not necessarily with the P450s. So I'll discuss P450 enzymes in a different episode. You also need to let your doctor know all the other list of medications you are taking. Why would you want to do that? Bipolar medications like Lamictal are not taken by themselves. They are teamed up with other medications to provide more effective benefits to you. You can now be taking mood stabilizer sometimes and not take antipsychotic. They will add some kind of antipsychotic to it to help keep your everything balanced, your neurotransmitters balanced, so that you are not going down to depression and then also reacting to become manic. You understand? So what you need to do is, depending on what type of medication you are taking, if that medication has P450 enzyme capability or is categorized under those type of medication, they may have to increase your medication to get it to be effective. They may have to increase, meaning that medication can decrease the effect of Lamictal. So if you are taking like 25 milligrams of Lamictal and you're taking those category of drugs, we can talk about those category of drugs in a different video. That means they may want to increase your Lamictal dose. So it is dose specific. If you are taking any medication that is associated or fall under the P450 enzymes category, if the medication have have an enzyme that affects the therapeutic function or levels of Lamictal, then you may want to discuss that so that they will bring what? They will give you increased dose. So it is dose specific and you need to discuss all your medications that you are taking. Thank you for watching this video. We will come back again in the future and discuss more treatment modalities or any topic you need me to discuss in mental health. Kindly let me know. We can put it here. If you have not followed me on Facebook, Apple Worldwide, kindly follow me there. If you have not followed me on Instagram, Apple_Worldwide, kindly follow me there. Follow me right here on TikTok, Apple Worldwide, and go to YouTube, guys. Subscribe to my YouTube channel, Apple Worldwide, and thank you for your support. I will see you in the next video. Any topic you want me to discuss in mental health, I'm a psychiatric nurse practitioner, kindly drop it here and let me discuss it with you. Leave a comment. What do you think of this video? Give it a thumb up and share it with your friends. You never know who it will be beneficial to. Thank you for watching. Bye.